Many of you have kids of all ages and they're stuck at home, and that definitely raises some specific concerns. Got a lot of questions about that online. And in collaboration with Facebook, our team of experts is here to help. We've got Dr. John Torres. He's here along with Jamie Howard now. She's a clinical psychologist at the Child Mind Institute. It's good to have you both here. Thank you. So let's get to the questions. Kathy on Facebook writes, this is for you, Dr. John. I'm 77 and have my 6-year-old grandson here today. My primary care doctor just told me no more contact with him or other family members as they are still out and about and going to stores. Can I see them outside as long as they stay 6 feet away and are not coughing or sneezing? I mean, so many grandmas and grandpas feeling this.
I get a lot of questions from grandparents wanting to see the grandkids, and it depends on why your primary care doctor is telling you to avoid them. If it's because you have issues, autoimmune issues, immune system issues, if you have risk factors, those different types of medical conditions.
I mean, more than just age.
More than just age, then you want to stay away from them. Even outdoors, you have to be a little bit careful because it's hard to tell a 6-year-old not to touch grandma, not to run over there and give her a hug, not to throw her a ball or anything like that. If you're a healthy 77-year-old and don't have any other conditions, then I don't see anything wrong with being outside as long, again, as that 6-year-old understands, hey, let's have this separation. Here's why we have the separation. And I wouldn't even play ball or anything, but just, kind of talk to them. And
stay 6 feet away. No hugs and kisses. None of that stuff. Okay, it's just temporary.
It's tough, and it's just temporary. We will
FaceTime is great right now for grandma and grandpa. Kelly from Facebook, Jamie, this is a question for you. What advice can you give on talking to your high school senior who is showing signs of depression and anxiety due to no school activities, no spring sports, the possibility of no prom and graduation? This is a biggie.
Yeah, it's super disappointing. So it's totally normal for kids to feel sad, even angry, disappointed right now. So you can validate that. But in time, in the next few weeks, we want kids to start to accept this. And then if they're still feeling sad or irritable most of the day, nearly every day for weeks, then we want to intervene. And we can intervene as parents, and we can say, you need to come out of your room. We're going to watch a movie as a family, for example. You need to go in the backyard a little bit. Or you can even see a mental health care professional right now. We're all seeing our patients remotely.
You are. Okay. Dr. John, this question is Elise on Instagram. She's asking, any feedback on breastfeeding? Should we be exposed to the virus at all?
We still don't know a whole lot about this virus. In particular, we don't know much about pregnant women, but the American College of Obstetricians and Gynecologists came out saying there's really no evidence that pregnant women have any increased risk of getting it or increased risk of complications from this. As far as breastfeeding, it doesn't seem like it passes through the breast milk. And what they do say is the baby has a bigger chance of catching coronavirus if the mom has it, if she's breathing or coughing or sneezing on them, than through the breast milk itself. So just make sure that you cover up, you do the things you need to do to protect the baby from you. And if you are breastfeeding and you have symptoms like that, think about pumping and giving them that way, somebody else breastfeeding them at the same time.
Okay, this is Lauren on Facebook asking, why are states shutting down schools but not daycares? What's the difference?
It was interesting. Yesterday in the press conference that the White House task force had, they asked that question, and Dr. Fauci paused for a minute and said, you're right. We should look at this, at putting daycares in the same equivalency as schools.
I thought they did.
And so I think they're going to look at it and they're going to say, let's go ahead and do that. But at this point, there's really no difference between the two.
All right, Jamie, this is a complicated question for some families. This is a viewer who wrote, with split families, kids are going back and forth between parents, homes, family, and friends. Is this safe? What's the best practice?
From a mental health perspective, you want to have routine and predictability. So if you can maintain your routine for switching homes, that's great. Hopefully you're on the same page about social distancing and having people inside the home. If not, maybe you need to change and have chunks of time, larger chunks of time, but tell your kids you're doing that so that it's still predictable for them.
What do you think
from a health perspective, for the most part, the same thing. The more contacts you have, the more risk you have, and so you want to be careful with that at the same point. If somebody's sick, obviously in one house, then absolutely do not go to the other house. If somebody's not sick, like Jamie said, just make sure they're practicing the same type of routines, the distancing, the hand washing, all that stuff.
All right, Jamie, thank you so much. Dr. Torres, thank you. Coming up.